Upon entering my patient's room, I will close the door to ensure patient privacy, perform hand hygiene, introduce myself, verify my patient, and explain the procedure. Hello, my name is Bessie. I'll be your nurse today. May I see your wristband? Can you confirm your name and date of birth? Thank you, Miss Jane Doe. Today, we're going to be giving you oxygen. Your oxygen levels are low, so the doctor has prescribed oxygen therapy. You'll be administered oxygen through this nasal cannula. Do you have any questions? Please note for this practice, this package is already opened, but I will proceed as if it was not opened. I would open my package, discard this appropriately into the proper receptacle. I would get my nasal cannula tubing connected to the oxygen source flow meter. I'll verify that this is the oxygen source and this is the correct flow meter. It is green, it says oxygen. I will connect the nasal cannula tubing. I will then adjust the flow meter. A nasal cannula allows 1 to 6 liters of oxygen flow. For this situation, my doctor has prescribed 4 liters. I'll adjust the flow meter to 4 liters per my doctor's orders. I will then get the nasal prongs and insert them into my patient's nostrils, gently guiding the tubing behind the ears under the chin. I will then secure the tubing, making sure it is still gentle and secure on my patient. I will then educate my patient. Okay, Miss Jane Doe, if you feel any pain or tenderness from the nasal cannula, please let us know. Also, if you experience any dry nostrils, please let us know. It's important that you keep your oxygen on at all times. If you need to get up and move, please contact us and let us know. Do you have any questions? Okay. I would then leave the room and come back. My patient's oxygen levels have not been improving, so the doctor has ordered a higher oxygen prescription. And I'll explain that to my patient. Hello, Miss Jane Doe. The doctor has ordered more oxygen for you because your oxygen levels are not improving. I would then gather my supplies and explain the procedure to my patient. So the doctor has ordered more oxygen for you. The nasal cannula only allows 1 to 6 liters of oxygen flow, but this non-rebreather mask allows 10 to 15 liters of oxygen flow, so it will allow a higher oxygen flow rate than the nasal cannula. So I'll be removing the nasal cannula and applying the non-rebreather mask, okay? Just so you know, with the non-rebreather mask, it has this bag. It might not fully inflate, but you are still receiving the proper amount of oxygen, okay? It also has these ventilators here that allows you to also breathe in oxygen, and it also allows for carbon dioxide exhausted outward. Do you have any questions? No? Okay. I would then discard the bag appropriately into the proper receptacle, connect the tubing to the non-rebreather mask, I would then disconnect the nasal cannula tubing from the flow meter, confirm that this oxygen source and this flow meter are still correct, and connect the non-rebreather mask tubing to the correct flow meter of the oxygen source. I will then adjust the oxygen rate, the flow rate. Because the non-rebreather mask allows 10 to 15 liters of oxygen flow, for this situation, my doctor has prescribed 12 liters. I will adjust the flow meter to 12 liters per my doctor's orders. I will then Gently remove the nasal cannula and discard of this appropriately. Now I can apply the non-rebreather mask, starting at the bridge of the nose, going downward, applying the elastic band around the head, pinching the metal centerpiece to bend toward to make sure it's a secure fit. Also pulling the strings from the elastic band to make sure it's a secure fit. I will then get my gauze and place it at the bridge of the nose and the ears. To prevent any skin breakdown or to prevent any pressure ulcers. And I'll explain that to my patient. Okay, Miss Jane Doe, it's important that you keep the non-rebreather mask on and the gauze in place on the nose of your bridge and your ears to prevent any skin breakdown or any pressure injuries. I'll be coming in every 2 hours checking these places to make sure that no pressure injuries are forming, okay? I would then leave the room. I would then enter my patient's room. My patient's oxygen levels are returning back to normal and the doctor has discontinued her oxygen, and I will explain that to my patient. Okay, Miss Jane Doe, your oxygen levels are back to normal. I'm going to be removing the non-rebreather mask now, okay? I'll begin by removing the gauze from the ears and the nose of the bridge, and then I will remove the mask. Once I've removed the mask, I will disconnect the tubing. I will turn off the flow meter, and then I will disconnect the tubing to the mask. Once I've completed disconnecting everything, I'll get the gauze and the mask and discard them appropriately. I would then make sure my patient is in a comfortable position, perform hand hygiene, and document the procedure. Okay, Ms. Jane Doe, are you comfortable? Okay, if you need anything, here's this call light. Please use it if you need to contact us. I'm going to leave now and document the procedure.